Good morning. My name is Gary Puckrin. I'm the Executive Director of the National Minority Quality Forum. I'm pleased to be here with you this morning in Miami to announce the launch of Test for Life Florida. We're going to have a brief agenda this morning. Evelyn Euler, I've known Evelyn for a while. God, time flies and we're still fighting the same fight. I'm so glad she's with us this morning. Alberto Santiano is going to be translating some of her remarks. Then we're really pleased that Congresswoman Ileana Ros-lehtinen is going to be joining us shortly. And then we're going to have a panel discussion. Albert Santiano, Manuel Lorena Vaga is going to be talking, Maria Rodriguez, and Dorelba Munoz is also going to be speaking. So thank you very much.
Good morning, everyone, and welcome. My name is Evelyn Euler, and I'm the Director of the Office of HIV/AIDS for Miami-Dade County Health Department. On behalf of the Honorable Governor Charlie Crist and Florida Department of Health Surgeon General Dr. Villamonte-Ross, I bring greetings and salutations on this 5th Annual National Latino AIDS Awareness Day. In our audience today, we have an AIDS champion who has worked diligently on legislation to respond to the unmet care and treatment needs of low-income individuals living with HIV to qualify for Medicaid coverage earlier in the course of their disease. The Early Treatment for HIV Act, EFA, gives states the option of adding HIV infection as an eligible category for Medicaid coverage. Ladies and gentlemen, I speak of the work of the Honorable Congresswoman Ileana Ros-lehtinen. Thank you, Congresswoman. We appreciate your efforts. The Early Treatment for HIV Act delays disease progression and increases life expectancy. Here in Florida, the AIDS Insurance Continuation Program, administered by the Health Council of South Florida through a contract with the Florida Department of Health, preserves the private health insurance coverage of low-income Floridians who have AIDS or are HIV symptomatic and need help paying their health insurance premiums, drug co-payments, and insurance deductibles. There are approximately 188 active AICP clients in Miami-Dade County, of which 49.5% are Latino. This statewide and innovative public-private partnership works with 15 community-based organizations to provide services to clients throughout the state. In Miami, we have one dedicated community-based organization who works in partnership with AICP. And joining us today is the Director of the AICP program, Mr. Robert Sanrock. Today, Miami joins over 350 cities and communities nationwide, including Puerto Rico and the United States Virgin Islands, in this annual observance. It is a day of hope for the future of a world without AIDS. It is the day of advocacy, mobilization, education, awareness. It is a day to encourage HIV testing and a day of heightened response to HIV/AIDS issues impacting Latino communities at disproportionate rates. Since the first reported case in July 1981, community-based AIDS service organizations and the Miami-Dade County Health Department have been fighting this pandemic. Incredible advances have been made, from the development of new drugs to breakthroughs in clinical research and care, to establishing groundbreaking prevention and education programs in our county. Sadly, Miami-Dade County ranks first in the nation, according to the Centers for Disease and Control and Prevention, among metropolitan areas in the rate of AIDS cases for 2005, and the state of Florida ranked second in the total number of reported HIV infections for the same year. While Miami-Dade's total inhabitants are 2.4 million, with Latinos comprising 62% of its population, it is estimated that 1 in every 182 Latinos is currently living with HIV infection in Miami-Dade County. That is simply one too many. Even more alarming is the average age at death for Latino males and females with AIDS. In our county, the average lifespan for Latino males is 40.8 years, and for Latina females, 41.7 years. Many factors fuel these alarming statistics. The epidemic in our county is shaped by numerous factors, as various socioeconomic problems associated with poverty, including a lack of formal education, unemployment, inadequate health insurance, and limited access to high-quality health care can directly or indirectly increase the risk for HIV infection. Migration patterns, social structure, and language barriers can affect awareness and hinder access to HIV/AIDS prevention and care. Recent immigrants face additional challenges such as social isolation and lack of information about HIV/AIDS, which can further increase their risk for exposure to HIV. And Latino men who have sex with men are more likely to have never been tested for HIV due to stigma and discrimination. Geographic differences, rural versus urban, with issues of transportation and stigma, challenge our prevention and treatment efforts. Let's not forget that 22 Latino subpopulations in our county require multiple approaches and interventions, including tailored messaging in various dialects of the Spanish language. And last but not least, of major concern are the lack of resources which do not keep pace with changes in the epidemic as well as population shifts. Despite these challenges, the work of dedicated staff and organizations countywide continue to make a difference. New HIV cases among Latino males have decreased by 5%, and amongst Latina females by 7%. Florida has the most aggressive testing program in the nation. Last year, we provided over 296,000 tests statewide, and this year we expect to surpass 310,000. Miami-Dade County represents over 30% of individuals tested. We in Miami-Dade continue to promote HIV testing as a routine part of medical care, and we are implementing new models of diagnosing HIV infections outside medical settings. Innovative practices to test in emergency rooms and jails, social marketing campaigns, initiatives to further decrease perinatal transmission, formative research, strengthened collaborations and leadership will assist in improving access to prevention, care, and treatment services for all. We know prevention saves lives. It is our hope, it is our desire that policymakers, elected officials, private sector businesses, public health officials at the state and federal levels, community-based leaders and organizations, activists, and advocates will continue to work proactively as we recommit today in an effort to strengthen the response to the HIV/AIDS epidemic. AIDS is truly everyone's business. In closing, please join me in a moment of silence to commemorate everyone who has been lost to this disease. Thank you. Now I take this opportunity to thank Test for Life for organizing today's forum and press event. I also want to acknowledge the presence of Ms. Maribel Zayas, Interim Director of the Miami-Dade County Health Department, and the HIV/AIDS management team. Thank you.
I've not had the pleasure to meet our next speaker before, but in Washington, her work and her leadership, particularly for her district, is well known. So it's a tremendous honor for me to introduce you to, in fact, I'm not introducing you, but ask you to come and speak because you know her much better than I, Congresswoman Ileana Ros-lehtinen.